Well, public health is the people who help the cities conquer the plague and cholera and typhoid.
I don't know.
Public health. I would say keeping
Sanitization?
yeah, it's public sanitization. What do you think?
Public. Just the healthiness of the public.
Well, I interpret public health as services for people that are needing health care. You go to the hospital to get service, to the doctor, right?
Public health system is universal health care.
I don't know.
Public health.
Health is a balance. It's a balance between physical, social, spiritual aspects of your life.
The challenge of public health is to help bring about changes in society that will advance the health of communities. But the starting points are not always the same. The things that promote health are not equally available in all communities.
It's hard to define public health because it isn't just the kinds of services we associate with public health departments. It isn't just inspecting restaurants to make sure that they're safe in the way they handle food and store food. And it isn't just the immunization of children against communicable disease. Those are activities that are very important to public health, but public health is a concept that I think is bigger than that.
If you look at what has changed the health status of a group of people or a population, it certainly hasn't been that we've been able to take tonsils out more efficiently, although that's important, I don't belittle it. But when you look at what public health is, it has a far greater impact on a broader range of population.
A community that offers quality education, an adequate income, meaningful work, safe, affordable shelter, a good food supply, clean water, and sanitation increases people's access to health. People need organized health services that respect cultural differences and people's right to control their own health.
I think a big part of it comes from something that we're really bad at doing, which is acknowledging that this is who we are, that we do these things. We drink, we have sex, and sometimes we make bad decisions. So let's be realistic about that and try to do as much as we can to help ourselves make good decisions.
Probably the biggest thing we can do in terms of creating healthy communities is becoming involved increasingly in the process of making priority decisions for our community.
The formal public health system was developed to protect the health of all by creating and maintaining safe physical and social environments. This system is directed by the provincial government and implemented by cities and towns.
Our long-term plan is for the whole community to be serviced with new water main, sewer main, especially the southwest quadrant of town, which is still on septic tank and tile field. Eventually, we hope that everybody that lives within the town site of Brockett is connected to the sewer system.
Healthy foods, right? You've got me there. I'm kind of...
I exercise a lot. I don't drive my car half of the year.
Inoculation.
Well, person don't drink, he works all the time now.
The good food we have, the nice weather we have.
Having a public health unit here, right?
They take your shots, they clean your teeth or whatever.
Oh, well, nutrition, they really talk about nutrition a lot and eating the wrong things.
I think everybody has to take a responsibility for helping to keep themselves healthy.
We often hear community and environmental groups raise questions about the effects of the social and physical environments on health.
There's a real sense of community. People know each other, people support each other. They don't have 2 nickels to go out and buy a coffee, but they have stories and they know how to have friendship and support each other, and that's promoting those opportunities and having a place for that kind of thing to happen is one of the ways that the co-op looks at promoting a healthy community.
We need to look at some of the broad issues behind health. Poverty is clearly a big one. There is a close correlation in all kinds of areas between poverty and poor health.
More and more, community residents are coming together to ensure that their health concerns are being heard and acted on by the policymakers.
We have to, when we talk about creating supportive social environments and reducing barriers, those are very nice phrases. We have to be really clear. We're talking about racism. We're talking about people being beaten up. We're talking about gay bashing. We're talking about poverty so severe people are, hungry. We're talking about people feeling so hopeless that they look for love, and the only substitute they manage to find for love is sex or using drugs to escape from it. Those are the kinds of things we're talking about. We have to really clearly name them. And then our next big struggle is, so now what do we do?
The issues are often complex, and difficult trade-offs must be made. We need regular and open public debate to resolve these issues. Public health advocates add their voices to this debate. The responsibility for action is shared between government, health advocates, and people in communities. There will always be a need for quality medical care and treatment. But through public health, we can greatly reduce the need for treatment simply by keeping people healthier.
I think in terms of public policy, health is really undergoing change right across the country, heavens across the continent. And while the Canada Health Act has served us extremely well over the last 3 decades, I think where we're moving to is certainly more into an area of prevention and the promotion of good health.
So we have to start focusing our efforts and our time and our energies on public health and looking much more seriously at health promotion, health education, and preventative kinds of programming.
The money we spend on public health is an investment in the health of people, in the productivity of our nation, and in the future of our healthcare system.
Equity in public health is about dealing with those things that are unjust and unfair and eliminating those kinds of barriers that prevent or make it very difficult for us to achieve a universally healthy community.
We benefit all of society by eliminating some of the problems that cause a great deal of cost to society. But at the same time, in order to maintain the fabric of society, we need to make sure that everybody has access to the services and programs that they need in order to be contributing members of this society. So even if we only care about the bottom line, the dollar figure, even then, I believe it's a good investment to invest in targeted health services.
I don't suppose anyone in this world would choose to be anything but healthy.
Health advocates, government, business and industry, and other groups support communities with healthy public policies, employment, and other resources that help people direct and improve the health of their communities.
If you happen to be born today, a young baby boy born today in this community, you will likely live a very long, healthy, productive life. But if we move just 20 blocks east of where we are right now in Edmonton and talk about another baby boy born today, the chances are very likely that he will live about 11 years less than his counterpart born 20 blocks to the west.
Together, we can work to build a vibrant economy that will close the gap between rich and poor and make health more accessible to all.
When we look at health, we talk about, or the NUNI Health Board basically defines health as striking a balance between the physical, the emotional, the mental, and the spiritual elements of the individual, leading to the ability to establish and maintain health and well-being.
The Alberta Public Health Association is made up of health advocates, community groups, and members of the public who are dedicated to improving the health of Alberta communities.
Health and safety of our people is to the point where we're not really satisfied yet, but I always aim high.
The challenge is to ask the tough questions that will promote dialogue on the things that make people healthy. By listening to and working with people in communities, the Alberta Public Health Association is a voice for the public, advocating policies and actions that will keep people healthy.